Hello everyone, this is Dr. Mac again with my video number 6. Today's video is all about giving an idea to people who are just starting. So many people message me and tell me, we've just passed part 1, where to start the journey. Where to start the journey, how do we start, how do we begin, what should be our first step. So today we're discussing all about those first steps, how to start, how to begin that clinical journey, yeah? So video number 6, all about that. All right, I should have made this video as video number 1, but when you're in the zone of helping people out, you don't even think what to do first and what to do last. So you just keep going, and that's what I did as well. I begin with a putty video, and so today we are here and we'll be discussing what you all been requesting. So first of all, if you passed part 1, congratulations. Okay, big congratulations to all of you. I know it's an exciting journey. I still remember when I passed my part 1. Very exciting. So yeah, congrats to all of you. But trust me, the bigger chunk is still there. When you come to the clinical exam, you need to give a lot more than you gave it to part 1, yeah? A lot more energy, a lot more enthusiasm, a lot more confidence, a lot more potential. So whatever is left there, bring a bit more help and give all that to your clinical exam, because you will much need that, all right? So let's start from the basics. How to start. First thing, without wasting time, set up the base. Your base is the place where you will be practicing the entire time, yeah? And that is your home setup. A lot of people say we have facilities at the clinic. You can do that as well. But it's a very wise decision to spend good amount of time. At least I would say take a month, take those 30 days, have a home setup ready. Do not rush into things and you don't have your home setup ready. It's the biggest mistake you'll do, yeah? So number 1, create a home setup. I would say if you have something in the clinic, they're happy for you to help as well working in the clinic. So someone in overseas, they already have their own clinics. You get the mannequin, which has a chair and table mount, both of them. So when you go to the clinic, the same mannequin used for the chair mount. When you come back at home, you can use the same mannequin for a table mount. Saves you heaps of money, all right? So number 1 thing, let's talk about what things you need for sort of like the home setup, yeah? Number 1, and again, I'm just gonna give you a rough idea what things you need. You can buy a lot of stuff. Have a look at the candidate's handbook. Everything is already, information is there, what you'd really need, what comes in the exam. Only buy things that are in the handbook. Don't buy enough things from people who've been selling from the previous pattern. You won't use those instruments. You won't use those utensils or things they've been selling. So there's no point of buying them, yeah? Only buy what in the handbook. So number 1, most important, once it comes to the home setup, is your mannequin head. Again, there are two places you can buy. One is Nevada, one is One Dental. Okay, One Dental is a bit expensive. Nevada is a bit cheap. I went for Nevada because Nevada was 900 something. One Dental was 2,400, right? And these days, One Dental is giving away refurbished sort of mannequins as well for $900. If you can get that would be the best, right? Otherwise, I would say go for Nevada. Don't need to spend an extra $1,500. You can spend that on loops. We'll discuss that later in the video. Okay, so mannequin head, go for Nevada. In Nevada, when you buy a mannequin head, you need the ADC mannequin. Tell them ADC mannequin, typhodonts are exactly similar. There's no difference. But just tell them to have an ADC Fletcher. Fletcher is basically the cheek. You don't need the soft cheek. Just tell them to have the ADC cheek. So exactly practice what comes in the exam. You need a compressor. Okay. You need sort of like a micro motor, which has a foot pedal as well. You need to buy 2 high speed, 2 slow speed, a burr kit. Burr kit, best to buy from One Dental. Yeah. Get some teeth along with when you're buying the mannequin. Just get some extra teeth. Just get basic teeth. Don't get confused. What teeth should I order? What should I order? Just get basic teeth, yeah? Some 6s, some 5s, some front teeth. Just get you started. Get you going, yeah? Order some basic instruments. Filling instruments, plastic instruments, 4-pack, examination instruments, a bit of probe. Get some basic instruments you get flowing. Order some micro brushes, yeah? Order some cheap $20 composite from eBay. Again, you're just getting started. You don't need expensive stuff. You just need to create that base to begin with, okay? Do that, all right? Another important thing, I would say the sooner you invest in it, again, it depends upon you. It all depends upon you. A lot of people don't like to wear loops. I highly, highly recommend loops. I feel if you don't wear loops, you are getting yourself in a big disadvantage. If I can see something this close, why not? A lot of people say, which loops do you recommend? There are my loops here. I usually wear this loops. These are horoscopic. I usually bought 2.5x. I think that's more than enough for what you need. I would highly recommend if you can buy a light as well. Trust me, a nice pair of loops without a light is I won't say useless, but it doesn't do much of a job. A lot of people say in the exam they have amazing light. Yes, they have amazing light. How about you haven't even practiced on a light, right? So whatever you're gonna practice on the next 1 year or 6 months or 9 months or 2 years or 3 years, you need to have light on that as well. People buy like normal torches or lamps. That doesn't work, guys. All right. I would say loops is a very good investment. Even after passing the exams, I know candidates and myself as well, I'll be using the same loops maybe for the next 5 years or 6 years. So don't say, oh my God, $1,500, $2,000, oh, that's too expensive. ADC Journey is expensive, but that is a very, very, very good investment. I would say buy a good pair of loops from the start. So you start in a very good way, in a good fashion, so you end that way as well. All right, if you just in the middle of a journey say, oh my God, don't have loops, that's okay. If you can't afford it in the start, I would again say it's all about the priority. It's not expensive, it's about the priority. If you really can't buy a better pair of loops, about 1,500, 2 grand, I would say get an eBay loop for $50, but at least buy the loops. Get in a habit of using loops. They are really, really essential, very helpful, okay? So first thing you need to work on is getting a home setup. So basic instruments, compressor, some micro motor, get the mannequin head, some teeth, some basic instruments, some cheap composite from eBay, okay? A curing light, $20 curing light from eBay again, okay? A lamp, a table, you know, a pair of loops. If you can't buy a good one, I would highly suggest getting your priorities right and get a good pair of loops, because a $50 one and a $1,500 one makes a big difference, all right? And even if you get it from eBay, there's a $30 light as well. Get that $30 light, but make sure you want the light in the loops, okay? Very, 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 very important, okay? Once you have the home setup sorted, then is your job to do your homework first. A lot of people say, okay, I'll just go to the 3 weeks course. I'll take this course. I'll do that course. And they haven't even started doing any homework. They don't know anything about the ADC format. They don't know anything about the exam. And they end up going to a course, which is amazing. And they come back from a course getting impressed and say, amazing. But after 3 months, they completely forget what was taught in the course. That's the worst bit you can do to yourself. I highly suggest taking a 3 weeks course. Again, from a highly recommended person. Don't take any just 3 weeks course, whoever's teaching. Not everyone's good. Again, I'm not here saying who's good or bad. I always say I don't like to comment on that. It's your decision who you want to go ahead with. However, it's important to understand not everybody is good. Not everybody knows the format really well. So always pick the right person for your ADC journey. It's very, very crucial. All right. First thing what I'll do is do your homework. Once you have the home setup ready, I want you to read the handbook, read the grading criteria, read what instruments coming, what tasks are coming, read the whole grading criteria per task. See what are they actually looking for, the communication things. Write it down, make your notes. What are they looking for the composite task? Write your notes. See the major errors. I always say whenever you look at the criteria, main focus should be on unsatisfactory and borderline. You need to understand what makes you fail and just pass. You need to know that margin. And then very important to understand a satisfactory criteria. Very important to understand staying away from ideal, because ideal can step you down to straight away to unsatisfactory. There's so many things. So read that, not just once. I want you to read the handbook 10 to 15 times. Read it every single day for the next 30 days. Whenever you read, you'll find something new and make your notes. Okay? First thing, home setup. Second, do your homework. Read the clinical guidelines. Read what the handbook says. Number 3, Dr. Muhammad Solomon has a YouTube page. He has discussed pretty much 15 to 20 videos, and that's all linked to ADC criteria. He's even discussed endo. Okay, I want you to watch all those 20 videos. He's discussed infection control. He has discussed class 4. He has discussed amalgam. He has discussed endo. He has discussed normal composite. He has discussed gold crown. He has discussed PFM crown. He has literally discussed so many things that they are there on the internet and you're not even looking for it. Yeah. So I want you to watch all those videos. Part of your homework. Yeah. Getting ready for that journey. Second, most important, Stevenson Dental Solution. Stevenson Dental Solution has discussed exactly the complex composite that comes in exam. He has discussed the complex amalgam, exactly what comes in the exam. He has discussed ceramic restorations. He has discussed PFM restorations. Now again, ceramic restoration don't come in the exam. I also know that. PFM does come in the exam. I want you to see that those videos. Get a bit of idea what you're aiming for. The main idea with ADC is we still at the end of the day confused. Is that what are we aiming for? Is that what we're aiming for? Because a lot of people get confused. They still don't know what the work is good or bad because they don't know the end result. If I don't know what I'm aiming for, I can never improve myself. It would be like a tough journey. All right. So number 1, base ready, home setup. Number 2, homework, watch the videos and read the guidelines. Do that and then start preparing. Just give yourself 4 weeks, give yourself 6 weeks, see what your handbook is like. Get a bit of idea, do some self-study. After that 4 to 6 weeks, once you have a bit of hand moving and you have a bit of idea, now is the time, which is number 4, most important, to take some demos from someone. Again, for someone who's actually really good, do not go to the course straight away. Take demos from someone. And again, I don't want you to take all the demos. Start with PFM, composite. That's 2. That's it. Once you have refined your skills in composite and PFM, then move to amalgam and provisional crown. Leave endo and caries for the last. Trust me, leave endo and caries for the last. Don't start from the start. Once you have these 4 tasks sorted, after demos, you have prepped yourself another month, 2 months, 3 months. Once you feel a bit confident and you've been reading the criteria every day, you've been understanding what the criteria needs, what the exam needs, what the handbook is saying. Yes, I've been going through closely. You have a bit of idea where you're going wrong, what are your mistakes. Now is the time to go for a course. When you go to the course, not only you'll get the exact idea what the exam wants, but they will also tell you, and you also can ask them, this is my mistakes, there is where I go wrong. Please help me correct this, and more tips and tricks, always welcome. That's where you improve. Now just imagine a person who has done his homework, he has done the demos, he has been practiced himself, then he goes to, after 4 months or 3 months, or at least for 8 weeks, and then he goes to the 3 weeks course. He would be a lot more confident. He already knows, and now he's trying to improve himself. Yes, learn more, but he's trying to improve himself. Work on his mistakes. That's what I want you to do as well. And then you will see that 3 weeks course is going to help you more. What people do, where they go wrong, they start and they say, I'm going to go that 3 weeks course. Now they go and they don't know anything. So you will get a good learning. However, By the time you start to realize what your mistakes are and how you improve them, now you have no one. So what are you gonna do again? Do you wanna take that 3 weeks course again? You can't afford it. We all can't afford it, right? Again and again. So that's why play wise, don't jump. One thing you have to understand, this is a long journey. Give your time, take your time, do not rush. When you rush through this journey, you can see the outcomes in people's preparation. When I do assessments, when I teach them and I ask them, okay, how long you've been studying? And they say, I've been practicing 2 months. And you can see, you don't even have to ask them how many times you've been practicing. You can see someone's work, you can see someone's communication skills, you can see how someone does their task, and you'd be like, this guy has been going really quick, he hasn't given the time. Practical exam needs time. Your hand skills needs time to improve. They need a bit of polish. You can't just say, I've done a month, now I'm ready for the exam. You will never be ready for the exam. This is not a part 1's exam that, okay, I'll give it a go, see how it goes. Don't do that. You're gonna get demotivated. You're gonna bring it down. They're gonna bring you down there at such a level that you're gonna get so demotivated that you'll be like, oh my God, this is such a tough exam. This is a tough exam. However, if you work on the right track, then you make your life a lot easier. Okay? All right, need some water. That's okay, let's carry on. So yeah, let's do that. And after that, I would say similar with communication. Usually 3 weeks courses do have communication as well. However, I would say take an orientation session from someone who can give you an idea of how to communicate. Do some homework yourself. I've posted on the page as well again and again that communication doesn't need a lot of knowledge. It needs just a bit of idea how to communicate in the exam, how to effectively, deliver your message, how to deliver that plan, how to manage the case, how to actually calm down an angry patient. This is more with the communication skills and less to do with knowledge. People have been reading 100 books, 50 books, not gonna help you when it comes to the scenario of helping and talking, yeah? So understand these points. Do your homework first, then do that. And then once you wisely choose an academy, 3 weeks course, you come back home, you already have discussed your mistakes. That's the time you practice yourself. Practice yourself another 3-4 months, see how you're going. And in that time, now is important to get your works regularly assessed from someone. If you don't get your work regularly assessed, you will never know where you're going wrong. A lot of people don't even realize what the criteria is asking and what they've been doing from the past 3 months or 6 months or even 2 years practicing ADC. And they feel they're doing a great job. And most of the time they are. However, they're failing on minor things. Minor things, criteria discrepancies which they don't understand, discrepancies. So yeah, I want you to work on these. So once you follow these steps, your journey would be a lot more easier. You will be a lot more confident and you would secure your place in the passing stages at a more reliable level. If you don't follow this, if you jump through and try to go quicker at that process, you would neglect that, and then you will see that, the outcomes you will see in your exams as well. I would say 90% is hard work, 10% is luck. I know luck is there as well. I would not deny it at all, but 90% is hard work. If you give everything, trust me, it would be hard to fail you. Still, I would say take demos from right people. I usually have offered that, if you're in a different city and if you can arrange me 5 to 6 people, I'm happy to come to your city and give you demos as well. I've done that in Brisbane, I've done that in other cities, and I'm happy to offer you that. I've been now, just to help more people, I've been started doing online assessments, which is half an hour consults. I will be doing 3 or 4 task assessment in that half an hour, explaining you the criteria and telling you where you're going wrong. Another thing I'm doing is doing orientation sessions for communication and OSCEs to let you understand what the thing is, where to start. Because I personally suggest is, if I give you a 3 weeks course, and I can, and anybody else can, it's good money for us as well, but you're not ready for it. What I normally suggest is just have 2-3 demos, have that orientation communication sessions with someone who lets you understand what the ADC wants, how we need to prepare, how we need to learn, how we need to look at all the cases. And then you do a homework bit of yourself, then you go to a course. All right. Another question I always get messages, why don't you open your own academy? My problem is I love teaching. I'm very passionate about it. That's why I always want to give back as much as I can. The only problem there is an academy needs a lot of time. If I open my own academy, I may earn a lot of money. At the end of the day, I won't be able to do dentistry, which I'm passionate about. I love teaching, but at the same time, I love dentistry. I want to practice dentistry as well. If you see all the people who've been teaching academies, either they're 4 or 5 people together, they're helping each other out. Either most of them, they're just doing dentistry 1 day a week, 2 days a week. Some are not even doing dentistry, just teaching. So I don't want to be one of those. I want to keep improving. I'm still working on doing my fellowship in certain things. I'm still doing courses. I'm still trying to improve myself every single day. I can't stop my learning. I tell everyone, no matter how skillful you are, no matter your 50 years experience, you still have a lot of room for more learning. So keep going. Whether you've passed ADC, whether you've done 20 fellowships, keep going. You don't stop. All right? So today, exactly what I'm discussing that these are the formats you need to follow. So make a home setup. Make sure you learn the guidelines. Make sure Mohammed Solomon, Steven Dental Solution, watch their videos. All right. Do some bit of work yourself. Then take some demos from authenticated people who know about the criteria. Only start with PFM composite. Only do a bit 1 or 2 months. Then go to amalgam and provisional. Oh, all right. And then you bit of work yourself. Then go to the academy. Take the 3 weeks course, learn everything, gather your mistakes while with your homework. So when you go to their academy, tell them this is the fault, this is the things go wrong, get all those trips and tricks, and then you go and study yourself. Get your works regularly assessed, all right? Then when you feel you're ready, give the exam. You know what's the worst thing you do to yourself? As soon as you pass part 1 and you get a date in 2 months, you say, I'm gonna go for it. Don't do that. I'm not gonna demotivate you and tell you you're not good enough, but you need to understand, as I'm saying, you need time for part 2. You cannot do it like part 1, I'll go and give it. Trust me guys, the pass rate is out of 32 people pass in one batch, or 24, 2 or 3 people pass, or 1 pass. Just imagine. Ask yourself. I always tell people, I may be able to cheat the whole world. I cannot cheat myself. Similar, likewise, goes to you as well. You may be able to cheat the whole world saying that I'm really good. You cannot cheat yourself. You will exactly know when you're ready. When you get that feeling, only then sit in the exam. All right? Take the course. Do the things I'm telling you. Take a few months preparing. Take more months, take 6 months doing your homework, doing assessments, taking demos. Then take the academy. Take another 2 months preparing. Give that 6 to 9 months good time. Trust me, there'll be a higher chance you might pass in the first attempt. But if you say that, no, I'm going to go and give it, I've known people, they've done 3rd attempt. And when I see their work is still really bad because they didn't give themselves enough time to prepare. So please do not do that mistake. Give enough time to prepare. I always tell you things that I've learned in this format, and I want to honestly help you. I just want to give you the best things that's going to guide you and help you. I'm not against anyone. A lot of people say, you say this. No, I'm not against anyone. That's why I don't like to comment, this is good, this is bad, take this course. They don't take this course. It's absolutely your choice at the end of the day. but I wanted to give you from my experience and my learning who are the best people to get teaching from. Okay, if you need demos from me, I'm happy to provide you. I've started giving online demos now for composite and provisional crown. These are the two that I can technically set up my camera setup and give you demos on. I may be starting PFM soon if I get the water control quality sorted with my camera. Online assessments are available for half an hour sessions. You should send me your work and then we can discuss that half an hour. Communication orientation sessions are available. Once you feel you've done the homework, then I do normally help an hourly sessions as well for communication. I'm happy to help you those as well. If you feel you live in a city, there are no demos available, no people available to help, I'm happy if you want to arrange me 5 people, 4 people minimum. I'm happy to come to your city, fly to your city for 2 days, and I'll teach you for those 2 days or 1 day. I'll cover all the demos, so I can clear down the gap to help maximum people out. Again, as I say, the main idea is to help. The only reason I made my page and started doing this video, because I promised myself when I passed the exam, is that I know how you feel when there's no help available, and I want to be that difference for people so I can provide that help, especially for people who cannot afford those 3 weeks or 4 weeks courses. And trust me guys, I know a lot of people who have passed the exams without going to the academies. They can just take demos from someone who actually understands the criteria well, and they have managed to pass the exam. So today's video again was all about where to start, where to begin. So I would say get your base sorted, do some homework first, do a bit of work yourself, get a bit of idea in your head what your level is, bit more learning. There's so much amazing stuff on YouTube and Instagram available these days. I don't want you to follow all of them, but some of them are actually really good. Some may say that ADC is different. However, a PFM crown anywhere in the world is done similarly. Once you have the base strong, you can just see the criteria, see, this ADC says, I'm gonna follow it. But you need to have that base strong. You need to have that hand level to get to that level so you can actually follow it, yeah? So do that, trust me, it'll make a much bigger difference for you passing and failing sooner. The sooner they do the hard work, the sooner you get your priorities right, the sooner you pass the exam. If you just cheat yourself and say, no, I'm ready, I don't need more learning, trust me, you're just gonna keep going deep inside that corner and it'll be hard for you to come back. All right, so get your priorities right, do your homework, get demos from people before you go to the academies, a bit of work yourself, and then you go to the academy, take a 3 weeks proper course, again from someone who actually understands the format. For me, if you ask me, genuinely, again, nobody has paid me for saying words. I don't listen to anyone. I feel, just trying to be honest, I would say, in my opinion, Dr. Bedo, he's the best. He's a magician. Trust me. I don't say it because I've taken his course. I say it because he'd been doing ADC from the longest. And the way he understands the format, nobody else does. So I always give an example. Everyone's good, but Dr. Bedo is the best. And when I was at your time and I was thinking which academy to go to, I was like, I want to take help from the best, not from good. All right? So if you want best help, I would say, and again, this is not a paid thing or anything, I would say go to Dr. Bedo's course. If you need demos, again, I'm happy, more than happy to deliver. The only reason I started doing online assessments for people who are in a different city and I can't really go with my work schedule is really busy as well. As I said, I love doing my dentistry, then just teaching as well. So I love my dental field. I just can't just skip my, seeing my patients and just teaching. So that is my side as well. I would say Dr. Bedo is the best. If you're looking for a 3 weeks course, if you ask me, I would openly say without a doubt, go to Dr. Beto. He's really, really amazing at what he does. All right. He has the most skillful level, and he understands the format and the criteria more than anyone else. And I would be really dishonest if I don't say Dr. Beto's name. So if someone even asks me, come and ask me, can I take a demo from you or Dr. Beto? I would say, go for Dr. Beto. Why are you even thinking? You know what I mean? So do that. Trust me. The idea is not to hurt someone's feelings. The idea is to provide you the best help. And in my opinion, these are the things and tricks that I did and helped me amazingly, yeah? Work for me really well, and the same I want you to do for you as well, all right? So work on these points first, and then after a while you will see you automatically have just completely transformed it for yourself, for your part 2 journey, okay? So start from the basics, get your priorities right, and most important, before I finish the video, stay confident. I had so many people who all used to doubt me every single day that Mac is this, Dr. Mac doesn't know this. And I was like, okay, I know it better than anybody else. You believe in yourself. You believe in your qualities. Don't listen to what people are saying. People's gonna tell you 200 times in a day that, you know, you're not good enough, you don't have experience, I have 20 experience, I have this experience, you know, he's just a baby, how can he teach? You know, you don't listen to people, you just do. Show them by your work, show them by your words, show them by your success. Don't listen to them. Trust me, just do what you have to do. Do what you have to do. Believe in your ability, stay confident, and keep going. And all the hard work is just gonna reach you that level, what you're aiming for. All right? So have a blessed day. Hope this video helps you. Just to give you a bit of idea where to start. And take your time, okay? Take your time, and I will see you again with another video. Dr. Mac signing off. Have a lovely Saturday and weekend to all of you. Bye.